Hello all and welcome to the pre-recorded talk on the Postgraduate Diploma in Implant Dentistry program. I am Dr. Ranjit Bapat, your moderator for today's talk, and we have Prof. Seow Liang, the Dean from School of Dentistry, who will take us through all the details and highlights of the Implant Dentistry program at IMU. Welcome, Prof. Seow. The stage is yours.
Thank you, Dr. Ranjit. Thank you for your kind introduction. Great to be here today. So let me share my screen and then we will move on to the talk. So today we will talk about the Postgraduate Diploma in Implant Dentistry program at the International Medical University. So this program is a very unique program designed especially for the working general dental practitioners. So it's very flexible learning. It has a 1 year full-time track or 2 years part-time track. And the intake is every year in the month of September. So this program covers both knowledge acquisition and also skills development to improve patient care and enable the general practitioners to provide implant treatment for their patients. So the program gives you face-to-face and also online lectures to acquire the knowledge. And for skills development, we have various modalities to do so. We have first preclinical training in the simulation lab and also for patient treatment in the clinical setting as well. So with this comprehensive coverage of knowledge and skills, you will be able to achieve the competencies to provide implant care for your patients. So that would complete a very comprehensive treatment planning for your patients. So why do you choose Implant Dentistry Diploma program at IMU? First, this program has been benchmarked to the Diploma in Implant Dentistry of the Royal College of Edinburgh. Then it is on a flexible learning option. As busy general dental practitioners, it is suitable for you as you can come on to study this program at the same time still work in your own clinic as well. And the course content and delivery was done by the dental experts, and it is very current, using up-to-date literature and delivering the state-of-the-art technology and equipment. And in this program, we have highly qualified and experienced specialists to share their knowledge and experience. We have periodontists, we have prosthodontists, and we also have radiologists as well. So with this comprehensive array of specialists, that would give you a very complete overview for treatment planning. As we know, implant dentistry is a prosthodontic driven kind of implant procedure. And also we have oral radiologists that would enhance your knowledge and skills in interpreting CBCT to give you a good knowledge and ground on planning using your CBCT. And the implant dentistry program is designed for working practitioners out there, because we have, besides the 1 week face-to-face module, we have a lot of resources in our e-learning platform And also we have a lot of online teaching and learning activity as well. So you can learn from the comfort of your home or during your free time in your own clinic. And it has 6 modules that will be delivered in 2 semesters with a total of 30 credit hours. 1 credit hour equals to 40 hours of student learning time. And this is delivered over a period of 1 year. In each module, there is a 1 week compulsory face-to-face teaching activity that require you to be here in IMU. And for the clinical activities, students have the choice of treating patients either at IMU Oral Health Center or at their own clinic. So if one chose to treat patients at their own clinic, then he or she can do the treatment planning with the clinical supervisors at IMU, and we have our part-time clinical supervisors that can go to the students' clinic to visit them. And we use a wide array of teaching and learning tools to impart the knowledge and skills. And the learning method is the up-to-date philosophy of education. So we have face-to-face lecture, we have online case-based learning, we also have a lot of hands-on activities to ensure that students acquire the skills needed to provide implant treatment for their patients. So the 6 modules that is within the program include the fundamentals and effective communication in implant dentistry, and implant treatment for partial edentulism, implant treatment for complete edentulism. So from these 2 modules, you can see that will cover both dentate, partially dentate, and also completely edentulous patient as well, with different mode of prosthesis to improve the aesthetics and function for your patient. And we also include a module on entrepreneurship and professionalism and managing complications, including multidisciplinary approach as well. And we have the other 2 modules that has their main focus on delivering the implant treatment for patients, i.e. the implant practice 1 and implant practice 2. So these 2 modules focuses on either treating patients at oral health center at IMU or in your own clinic. And in between, we have a lot of comprehensive case-based discussion with the supervisors at IMU. So in IMU, we have facilities to ensure that you acquire your skills. So we have preclinical lab where a lot of activities will happen. For example, placement of implant in simulated models, on periodontal surgery, on impression taking. And after you achieve the competencies in the preclinical setting and also confidence to place the implant, then we move on to the clinical settings. So we have specialists who will provide very close supervision to you to ensure that you are guided step by step in providing the implant treatment care for your patient. So what we want to achieve ultimately is a high standard of care for all your patients. And with that, we also have a comprehensive equipment to help you to provide the treatment for your patient. First, we have ITI Online Academic Campus, where you can go through a lot of real life clinical cases that you will be able to relate to your own patient case. We also have the state-of-the-art intraoral scanner. We have physio dispenser. We have CBCT machines to ensure that you have a 3D comprehensive planning for your patients. And in the lab, we have CAD/CAM machines that will be able to provide a digital workflow for you. We also have DTX Studio software for computer-guided surgery to ensure a very predictable outcome for your patients. And to get the diploma, of course, you need to be ensured that you have acquired the knowledge and skills. So we have various assessments for us to assess you to ensure that you have achieved the level of competency required for the program. So we have formative assessment. We have also got summative assessment as well. So the assessment component include a portfolio of the cases that you treat and case reports for your patient. We have one best answer. It's quite similar to objective questions like the MCQ. And we have short answer questions, written assignment, and also a clinical component for assessment that is the objective structured clinical examination, in short, the OSCE examination. So this is the overview of the various assessment components we have laid down for this particular program. So I hope this will give you a good overview of the whole program.
Thank you so much, Prof. Seow. Sounds like the students will have a very comprehensive learning in this course. So let's go on to the FAQs. Yeah, so one of the point, Prof, you highlighted as this is a 1-year full-time course. Will the students be able to complete this course in 1 year if they're working full-time as well?
Yes, this course has been designed with the busy general dental practitioners in mind. So this course can be done in 1 year full-time or 2 years part-time. If you feel that 1 year is too short of a time to complete all the patient treatment, you can also opt for a part-time track. So for part-time track, you have 2 years to complete the program. Meaning to say, the first year, you can complete all the teaching and learning for the 6 modules, and then you have longer period of time to complete your patient treatment to be eligible to sit for the final exam for this program.
Oh, that's great. It means that the program is really quite flexible for the general
Yes.
practitioners.
Yeah, you
Thank you
can
for the
do
info.
full-time, 1 year, or 2 years part-time.
Yeah, thank you so much. Now let's move to the question number 2. Will the students who register for this program will get the diploma in implant dentistry from the Royal College of Surgeons of Edinburgh, since as you mentioned that this program is benchmarked to this qualification?
Okay, thank you for the question. This program has been benchmarked to the diploma in implant dentistry in terms of the learning outcome. To obtain the diploma in implant dentistry from the Royal College of Surgeons of Edinburgh, a person would need to sit for the exam. So the exam has a theory component and also clinical component, the OSCE examination. And in order to be eligible to sit for the exam, you also need to have a portfolio of clinical cases, which at this point in time, 15 cases is required. So with this diploma from IMU, you would have completed some patient treatment. So if you continue to treat your patients in your own clinic, eventually you will be eligible to sit for the diploma examination in implant dentistry by the Royal College.
All right. Thank you, Prof. Seow. Thank you so much. So I understand it is a separate exam. Okay, that's great.
Yes, that's right. So to obtain that diploma, you need to sit for the exam. However, the teaching and learning in IMU will be well preparing you for sitting for the examination. And at the same time, you would have also completed some patient treatment cases as well.
Yeah. Okay, that's great. Thank you so much, Prof. Seow. Now let us go to the last question of the talk. If the students need to treat their patients who require the dental implant treatment, then what will be the arrangement and the cost for these patients?
Okay, Dr. Ranjit, thank you for the questions. So for patients required implant treatment, the students can choose to either treat them at IMU Oral Health Center or at their own clinic. So if one choose to treat the patients at IMU Oral Health Center, we have our own fee structure, which is a much reduced cost for the patient. If the students choose to treat the patients at their own clinic, then that will follow the fee structure that is determined by their own clinic.
Okay, so that's really a good option for the even for the betterment of the patients, I think so, and even good for the even for the students who enroll to have a good number of cases to treat the patients in IMU. Thank
Yeah.
you so much for the
Yeah.
information. Yeah.
So I would also like to stress on, like I have mentioned before, all the cases that the students treat will have a discussion with the clinical supervisor at IMU, and the treatment planning agreed upon by the student and also the supervisor. We have also got external part-time clinical supervisor that can go to the student's clinic to provide supervision for the student.
Oh, that's really a great option for the students, especially since many of them will be general practitioners. That would really be a great option to treat the patients in their own clinic with an additional expertise besides chair side for their patients. That's wonderful. Thank you so much,
Yes.
Prof. Siao. Thank you so much for all the relevant
You're most
information about the program.
welcome.
So, with this, we have come to the end of this talk and this session. Please visit our website www.imu.edu.my to know more about the implant dentistry program at IMU. Thank you.
Thank you, everyone. Have a good day. Bye.